Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. Thank you to all of you who are joining us today on GoToWebinar, Facebook Live, and YouTube Live. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our expert today, please feel free to post your questions on Facebook and YouTube, or type them into the question box if you're joining us on GoToWebinar. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. As you age, the way you manage your MS symptoms changes. And that means adopting new habits, new routines, and a different mindset. Today, we're talking about coping with MS and age-related changes. We'll dive into age-specific preventive health measures, managing other chronic health conditions, cognitive and emotional changes, hormonal changes, and of course, your questions. Joining us as our expert is Dr. Jaime Imitola. Dr. Imitola is the director of the Division of Multiple Sclerosis and Translational Neuroimmunology at UConn Health. He's a board-certified neurologist with clinical expertise in aggressive and progressive multiple sclerosis, late-onset multiple sclerosis, and neuromyelitis optica spectrum disorder. Dr. Imitola brings to today's conversation over 20 years of experience focused on progressive MS, along with expertise in the design, execution, and oversight of translational research trials for multiple sclerosis and spasticity. Welcome and thank you for joining us today, Dr. Imitola.
Okay, 1 second. All right. Oh, thank you. Thank you very much for the kind invitation, and I'm very pleased and humble for the opportunity to share our expertise in aging with MS. Thanks.
Before we get into our discussion of aging and MS, we want to take time for a short update about the COVID-19 vaccines and disease-modifying therapies. And as we get to that update, it's important for everyone to remember that COVID-19 is a new coronavirus, and the published data available about this virus and MS are limited. The information and recommendations presented in today's program are based upon individual professional opinion of MS experts and the evidence currently available about MS, COVID-19, vaccines, and disease-modifying therapies. The information that's shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. Dr. Imitola, you're a member of the group of experts that the Society convened to develop guidance for people living with MS when it comes to making decisions about the safety, efficacy, and the timing of COVID-19 vaccines with certain disease-modifying therapies. So you are the ideal person to be sharing this update today. And I think first and foremost, this is something that we've said before, but it bears repeating as often as possible. Does the MS Society's expert task force recommend the currently approved COVID-19 vaccines for people living with MS?
Yes, the short answer is yes. We convene 12 people from different backgrounds, neurologists, immunologists, virologists. We have met over the last probably 6 weeks, and we study available evidence, experience with other vaccines, and the overwhelming consensus is that these vaccines are safe and it's important that patients with MS get the vaccine as soon as is available to them.
Many of our viewers are asking if they need to stop or hold off on starting a disease-modifying therapy before getting one of the COVID-19 vaccines. So what is your group recommending?
So the group recommends that it depends of the medications. There is a group of medications that there is no need to stop the current timing or the dosage of the medication. There are a couple of medications, specifically the medications that targets B cells that may be important to have a conversation with the MS providers. In the website of the MS Society, we have a very long list of detailed explanation of what to do. But in general, the consensus is that we have to, in certain occasions or certain combination of medications, we have to have a timing or have a coordination of the timing between the dosage of the vaccine and the dose of the DMT. The idea is as follows. If there is a patient that will start for the first time one of these DMTs, perhaps he should wait until he gets the vaccine, and then 4 weeks after the second dosage, then the patient can go into the medication. And now, if the patient is stable, there are certain categories of timing. In the case of ocrelizumab, perhaps 12 weeks is the one that we are recommending. There are other medications that are a little bit more infrequent, but they are very potent, and we offer a different timing around between 12 and 24 weeks after the vaccination. So the point here is that depending on what kind of DMT the patient is actually taking, there is a conversation that needs to be taking place with the doctor. However, I think that this is a very important point, is that we are in an emergency, and at the end of the day, there is a balance between the exposure, the risk of getting COVID-19 and having been, a very serious side effects or being hospitalized or even dead, versus the need for the DMT. So I think that in our consensus is that if the patient gets the vaccine offered and is stable, the patient should go and take the vaccine. And this is a very important point, because at the end of the day, this is a choice between the patient and his or her doctor. We provide recommendations, but at the end of the day, this is something that needs to be discussed between the MS provider and the patient.
Do the vaccines impact how disease-modifying therapies work or make them any less effective than they otherwise would be?
Yeah, we have a lot of experience with other vaccines and some of the medications, and probably one of the focus, the majority of MS medications don't alter the responses. There are some medications that are very good trials done in B-cell depletion medications. And yes, there is a decrease, but not to the point that we will consider that very significant. In addition to that, it is important to say that the responses to COVID-19, the way that your immune system responds to COVID-19, doesn't just depend on one type of cell. In general, in the community, we're told about the antibodies and antibodies, but in reality, for viral infections, you need a lot of T cells, 3 kinds of T cells, in addition to the B cells. So I think that in the consensus is that even though there are medications like ocrelizumab or others that may decrease, because we have the experience, we haven't done any studies specifically with COVID-19 vaccination, but we consider that this is not to the point that is going to be completely mute or completely negative.
So I think most importantly, perhaps, that someone who's on a disease-modifying therapy wants to do a check in with their neurologist or MS specialist before scheduling that vaccine?
Yeah, we have actually, we here in our center, every single morning, we have many cases and calling, many people call. So the idea is that at the end of the day, it is a decision that depends on many circumstances. It depends on how bad is your MS, how stable is your MS, when is your vaccines going to be offered, obviously what medication you have, and obviously your values. What do you put first? You know, I mean, we are in an emergency. If you are in a state with high levels of infection, perhaps you want to get this done and you know, start your immunological memory. At the end of the day, we need to remind ourselves that despite the vaccinations, we still need to wear a mask and you know, follow the CDC guidelines in terms of social distancing, especially if we live in multi-generational families and crowded homes, and we go to events that are, you know, with a lot of people. We should actually avoid that.
Well, thank you for updating us on this very important topic. I want to let our audience know that we're planning an in-depth update about the COVID-19 vaccines and MS in just a couple of weeks on our February 19th edition of Ask an MS Expert. So you may want to make a note of that on your calendars today. Before we continue our discussion, I also want to welcome those of you who've continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the question box if you joined us on GoToWebinar. Our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and friends and on all your social channels. Now let's talk about aging with MS. With more effective treatments for MS, people living with MS can expect to live well into old age. And with increasing numbers of older adults with MS, it's important for healthcare providers to be attentive to the relationship between multiple sclerosis and normal age-related changes. Dr. Imitola, we know following general preventative health measures is just as important for those people living with MS as it is for all of us. What are examples of common preventative healthcare measures that people should keep in mind?
Yeah, so this is a great question, and it's important to me. I'm interested in aging, and we here develop a program of MS and aging together with the UConn Center for Aging. So what we do is try to collaborate and identify areas that are needed for healthy aging. We say that instead of just age, you need to add life to your years. And in terms of the specific questions, well, there are several things that are needed. One is to get an idea of what is the status of your overall health. And the way we do that is actually by doing preventive measures that are related to diagnosing or anticipating issues that can happen as you age. For instance, cancer. I mean, we know that there are some recommendations about blood or cold blood in the stool. That's an important consideration when and how to do a colonoscopy. That's an important issue. We think that things like hearing, an analysis of your hearing is important after age 50. One that is very important for us in MS is the issue of bone density, because we have the experience of patients that have been in medications like prednisone or long-term steroids or other medications, and the issue of falls in MS. So we know, and we would like to perhaps suggest that patients over the age of 55, they periodically go and get this evaluation. Now, the way we do that is that we work together with the primary care doctor. So this is an important thing. If you are a patient with MS that is age 55 or older, I mean, everybody needs a great primary care doctor, but especially MS patients, so we can actually work collaboratively and cooperatively to see what areas require more work. Remember one thing that is important: MS is not just one thing. MS depends of the patients. I always tell patients, MS patients are like flowers. You know one when you see them, but they are all different. So the same happens in your disease trajectory. I like to talk about trajectories and the amount of disability and the amount of burden. So all of those important concepts are going to be evaluated at the moment where we consider the aging process in MS. So I think that we need to have an idea of how is the status of the overall health of the patient. And we do that by preventative measure, meaning we need to investigate how are things, and that's the regular health checkup, and also how the MS is going on, what's going on with the MS, what is the burden of disease, what is the burden of symptoms.
Are there specific recommendations for men and then different specific recommendations for women?
Yeah, and that's a very important question. When you get a certain age, there is a dichotomy or a separation of what we call comorbidities. Comorbidities are basically other diseases that happens in people, regular people, like hypertension, diabetes, cardiovascular diseases. In women, there is a lot of depression, anxiety. There are hormonal changes that are very important, and they can compound and they can worsen the symptoms of MS. In contrast, in patients, in male patients, you have the urology issues, you have also the cardiovascular issue, and the risk of a stroke and diabetes. And that can really, really impair the long-term trajectory of the patient.
Well, I'm glad you brought up comorbidities or coexisting health conditions that may be separate from MS, but may somehow still be affecting a patient. What are some chronic health conditions that someone may experience as they get older?
Well, there are several. As I said, hypertension, diabetes, these are very important, osteoporosis, and the risk of falling or the inability to be, to have a normal gait. That's something that happens in normal aging, and this worsen if you have MS, and obviously if you have MS, that affects some of the areas that has to do with your gait, either in the spinal cord lesions or lesions in the brainstem. So these are very important components to evaluating every patient, especially the issue of falling, and in addition, the issue of stroke. I mean, because we know that your age, you enter 50, 65 years old, we can see that. And one of the important issues that we need to discuss is the issue of smoking. Smoking is associated with actually accelerating aging, at the level of the cells. It actually triggers more activity of the immune cells. And we know that the smoking worsens the cognitive decline, worsens the amount of lesions in MS, and makes the disease actually get really, really bad quickly.
Many of our viewers are wondering how they can tell if they're experiencing an MS symptom or an age-related change. What kinds of things should they look for?
Yeah, this is a great question. And I think that as a quick introduction, I will tell all our viewers and listeners that, you need to know your disease a little bit better. I mean, I know that we have the interest, and we go to Wikipedia, we go to Google, and we kind of get a sense of we try to get a sense of what happens to us based on what we read. But the best teaching tool is actually your MS doctor. You need to ask questions. You need to know exactly what happens. So in this regard, there are several important things. One is, okay, so what is a relapse? What is the expectation of a symptom of MS that can be there? For instance, if you had optic neuritis and you get exposed to the sun, or you take a hot shower, or you're tired at the end of the day, you may have some symptoms coming back, not to the same extent, but then you have them. And then, usually you call me and say, well, I'm flaring up. And I say, okay, so what happened? So you can have a UTI. UTIs are also important, especially in patients with spinal cord lesions. UTI stands for urinary tract infection. So if you have a urinary tract infection and you have symptoms of pain or numbness or tingling, that is not a relapse. That's not an MS relapse. We call it pseudo relapse. It's important though, but knowing these things can make it different in the level of anxiety and depression of the patient. Now, things that happens in normal aging, as I mentioned to you, the lack of clumsiness can happen as an issue associated with gait instability. The issue of having some troubles multitasking, depending on the age of the patient. Many patients, when they get to older, 70s, 80 years old, you can have a little bit of that. And also the issue of mood changes, and depending of whether or not, depending on what we call premorbid personality, depending on who you are, what kind of person you are. If you're anxious or you are a person that is, calmer, you can have the evolution of worsening symptoms. Depression is very important as you get older, because you can get lonely. Your spouse may be with you, may not be with you, maybe your kids are with you. So all of those things are important to anticipate the needs of that patient. And by the way, it's not bad to feel bad because you're alone. And the point is that, at your age, there are ways to compensate, and there are ways to improve the sense of loneliness, and that is appreciated in many patients.
While we're talking about things that people can do, routine vaccines, aside from the COVID vaccine, but routine vaccines are part of general preventative health measures. But some people with MS have concerns about the safety of vaccines in general. What are the recommendations about routine vaccines for people living with MS?
Yeah, the recommendations are as follows. We don't encourage live vaccinations. These are rare occurrences. The most important vaccinations that we were dealing on a daily basis are the flu vaccine, the varicella vaccine, and these are vaccines that you can actually have. You have to organize with your MS provider. You have to know the timing of the medications. But the flu vaccine, for instance, is a vaccine that there are several, but the one that we use, the quadrivalent the shot, that's the most common name, is quite okay in MS. Now, the issue of side effects, yes, there are many occasions where people associate vaccinations with potential side effects, but in reality, the studies that we have done over the years, these are rare, very rare occasions. So we think that it's important to get your flu vaccine, and if you need to start a medication for MS that requires a number of vaccines, we recommend that those vaccines are done prior to the initiation of your medications.
Let's talk a little bit about using disease-modifying therapies as people with MS age. To begin with, how does the immune system change as someone ages?
Yeah, this is a great question. We have a name for that. We call it immunoaging or immunosenescence. And the reality is that certain areas of the immune system decrease their ability to fight diseases or even to start an autoimmune process. We remember that MS is more frequent between 18 and 40. And it's very rare to find people with MS later on. However, there are some other branches of the immune system that gets a little bit more prickly, more active. And those are the ones that we we tend to be a little bit concerned. I mean, there is a branch of the immune system we call innate immunity, macrophages, monocytes, and microglia, that they respond. They tend to over-respond to things, and that's why, you know, in the case of flu, sometimes you get patients that when they were 30s, they got a flu and, you know, they were okay, but when you become like 60, you get a huge pneumonia, you get a lot of you know, a huge infection, and then you can get from infection to an overwhelming infection, and then you may have a fatality. So the immune system is very tricky because there are portions that are decreased as you age, but there are other portions that get more activated, and that can be a little bit you know, dangerous in certain occasions.
If someone's MS has been stable for years, can they age out of taking disease-modifying therapies?
Yeah, this is a $1 million question, and this is very important. Our colleague, Dr. Corroy from Colorado, is actually leading a big study that is called discontinuation of MS medications in patients that are older. And there are two ways to answer this question. I mean, the studies that are done are very limited, very not powered. And we know that if you stop NMS medication, there is a possibility from 15% to 40% that the disease come back. And obviously that depends on your prior burden of disease. Let me explain. If you had bad MS before, when I talk about bad MS, I'm talking about big lesions, a lot of burden, a lot of relapse. If you stop the medication, it's very likely that that come back, and that can create a lot of disability. Remember that our goal is to prevent disability progression. But in many cases, like you pointed out, I have a lot of people and that are more than 65, and they say, well, you know, I've been stable, my MRI is stable, can I get out of the medications? Well, I mean, this is something that is a shared decision process between me, the MS doctor, and the patient. And I said, you know, if you're interested, perhaps that would be a good idea, because listen, this is the evidence that we have. You know, your disease has been stable for more than 5 years in the MRI and also the actual symptoms. There is no relapse, but there is a caveat. The caveat is that this disease can come back. So we need to be honest and open this. And many patients say, you know, I don't want to stop it. I want to continue. Or some patients say, well, you know, I need to stop it because it's costing me $50,000 a year, and I don't have that kind of money, etc. So the idea, at the end of the day, the reality of this is that we are actually trying to answer that question in terms of a prospective, well-funded, with a lot of patients, clinical trial that is actually ongoing at this moment. So at the end of the day, I'm not advocating anyone that is listening that you can say, well, I don't want to take my medication. It's an individual decision, and it's an individual decision that you have to do with your MS doctor, and that has to be clear. That's what, when we start your medication, we go into a shared decision process, and if we're going to stop you or change you, we go into the same decision process. So it's a team effort.
MS can cause variable symptoms, and so can aging. We know cognitive and emotional changes are common in MS, but I think you've pointed out those things also decline due to aging. So first, what are some cognitive changes a person may experience as a symptom of MS?
This is a great question. I get that question a lot in all my patients that are more than 60. And the issue depends. I think it's important to say here, and it's important to teach my patients about what I call the burden of disease. There are symptoms that are seen, that you can see, that are there, and there are others that you can't see. For the depression, anxiety, so important, right? And you, as a patient, you can be depressed and that influences your cognition. But when I see the MRI is completely okay. In contrast, there are many patients where their brains are affected. There is a lot of atrophy. There is a lot of lesions, and those patients may have a lot already of alterations in cognition. So your doctor will make an assessment of these invisible symptoms and these visible changes in your MRI. So I think it's important for you to know that. I mean, that's very important. I don't want you to get the idea that anything that happens in your life is because of MS. You know, you can have depression for other reasons. It is true that 50% of patients with MS will experience depression at some point, but the answer, it depends on your burden. So I always talk about the burden of lesions and the burden of symptoms as an important component of how you need to know about your disease.
So it sounds as though cognitive changes may occur as a symptom of MS. They may also, or instead of that, occur simply as someone ages, and the same is true with some of these emotional changes like depression. How can people living with MS best adjust to these cognitive and emotional changes as they age?
Yeah, and before we go there, I mean, one thing that is important to note is this. There is something that I teach patients, is that many patients with MS said to me, oh, you know, I cannot do my job, I cannot concentrate, I forget this and that. And I ask the question, is your family members worry about you? Usually when you worry, when you start saying that there are some of the symptoms, probably it's lack of attention or fatigue that actually is very important for decreasing the ability for you to focus, right? But if the family members is saying, oh, John, what's going on with you? You know, you used to do this and now you can. And then you say, no, I'm fine, I'm fine. You know, John, I mean, we caught you 3 a.m. in the morning in the garage. What were you doing? And you go, no, I'm okay. Well, when the family members start to worry, that's when you know that there is something there that is important. So how do you adjust? Again, we go back to the question. You need to have an assessment. Sometimes the assessment will require a battery of tests, including a neuropsychological assessment, to actually parse what is what. I mean, sometimes I have patients that are very depressed and they cannot function. So you tackle the depression and they get better. And I have patients that they have tons of lesions, and there are some strategies there that we can work on, and they get better. So the compensation is established specifically after a lengthy evaluation that sometimes is needed because you want to compensate. The question for many patients, or the point for many patients, is how do you get there? How do you avoid that? Well, you avoid that by increasing your fund of knowledge, reading as much as you can, having a healthy diet, not smoking, and following the recommendations as you age that are required. Hypertension. People with hypertension will have burden of hypertensive disease in the brain, and that is also associated with cognition.
You know, MS is 3 times more common in women than men. So let's talk about hormonal changes and menopause, as these are both a natural part of the aging process. Can hormonal changes affect MS symptoms?
Oh, yes. And this is very important, as I mentioned to you before. I usually, when I see patients that are older than 50 coming for the first time to see me, I get an idea of what the problems are. There are many issues, right? And the hormonal changes, especially the postmenopausal or premenopausal symptoms, are very relevant. And there are very good studies done around the world, and from Spain to the United States, where we know that hormonal changes, especially with the estrogens, can alter the symptoms and can get worse. In addition, hormonal changes can reduce the level of estrogens that can lead to urology or sexual alterations. And so that's an important thing. So many women will complain that there is changes in her intimacy with the partners because there is no lubrication and there is pain. And that's part of the whole package. And this is part of the things that we need to address with patients. And yeah.
Do you recommend that women with MS use hormone replacement therapy during menopause?
Yes, so the answer to that is partially yes. And again, what I don't work on this particular question myself. I have to work with our team of endocrinologists that they do this all the time. I mean, as an MS doctor, I'm leading the comprehensive care of a patient, but based on the literature, based on the reports and the studies at this moment, we think that that can help, provided that the endocrinologist is okay with that. However, we need more studies to completely confirm the efficacy. One of the limitations of the studies is that they are very small and limited, but I think that every person that is going to menopause has to have a assessment with endocrinologist, and if there is no contraindication from them, perhaps that person can start.
As our bodies age, we see differences in physical functioning. Many older adults, including those with MS, want to stay as independent as possible. So is it safe for older adults living with MS to stay active?
Oh yeah, that's a great question. One thing that every patient needs to know, again, and I go back to this question of your individual trajectory. You need to know what is your MS, not the neighbor's MS. And so the idea is that everybody needs to have a plan for physical therapy. Many patients will say to me, well, I'm okay, I can walk. Well, that's okay. One of the biggest issues in this is the falling and the gait instability. That's a significant problem with MS patients. And we need to ask patients to be active and stay engaged, but that according to the level of disability, there are things that can be done. For instance, what is the goal of PT in many patients? You can see it. I mean, some patients will tell me, well, I have right leg weakness. Why should I get physical therapy again? And the patient can walk, but he walks, with certain instability in the right leg. I say, if you don't do anything, if you stay in your chair or you just stay watching TV, the muscle of that right leg is going to decrease. That has a name. It's called sarcopenia. And once you lose the muscle, you're not going to have muscle to contract. Therefore, the idea is to maintain a certain level of exercise. And here's where we work closely with physical therapy here. So there are 3 goals: clearance, endurance, and safety. Clearance, endurance, and safety. So every patient with MS that walks funny, that he's what we call furniture walker, that he stumble, the number of falls acceptable in MS is 0. You cannot fall. I have a lot of experience in people that, they are a little bit stubborn and they don't use the walker, they use the cane. I have people walking through windows, walking through glass doors. I have people falling in basements, having bleeds in the head because, they don't heed the word. So I think that it's important that there is a certain level of engagement. Obviously, the more disabled or the more disability you have, there will be a change there, but every patient has to have a plan for physical activity. Now, finally, you can say, well, I'm in the wheelchair, what am I gonna do? Well, if you can use your hands, boy, you can do a lot with your hands. So, I mean, upper extremity function is important, not only for you, it's a target of care. It's a target of our goal of care for MS patients.
So how can someone recognize when they need assistance? When is it time to ask for help?
Yeah, I think that in my experience and based on the experience of others and the work that is being published, as soon as there is, continued dizziness, gait instability, meaning that you cannot stand or you cannot walk for a certain period of distance, when you have troubles getting out of the bathroom and you have near falls. Near falls are actually a very important predictor of falling. And I can tell you that please, if you have near falls, you're just one fall away from breaking something, as I call it, important. You break your hip, it's going to be very, very disturbing because your life is going to be upside down. And if you break your hip and you cannot walk before, well, it's going to be very tough going after. So if there's anything that you can get from today's is that you need to be active, proactive, participatory, and engaging in your own physical therapy approach so you can actually improve your risk of falling.
Well, speaking of being active and proactive, planning for future needs as you age with MS is one way to feel more in control. How can a person's neurologist or MS specialist help them plan for their potential needs as they age?
Yeah, there are several. This is an important issue, and we have here, we have patients that are more than 70. I have patients that are 75. Some of which they are not in any medications, and we do what we call symptomatic therapy. And those are this plan depends on the goals. What are the goals, and also what is the level of disability that you have? Many patients will be in wheelchairs, and there are levels of discussions, like power of attorney, conservatorship, etc. So depending on what the level of disease you have, we have to have several kinds of discussion. But this is important in the planning phase, especially when you are engaged in this discussion that we call the first visit of a patient that is more than 65 and having MS. Yes, we have here, there are many places also that we can engage our social workers with a lot of experience in care for patients. We can facilitate home visits of nurses. There are many hurdles that the patient might present, keeping track of medications, keeping track of appointments. And now with telemedicine, that actually helps a great deal because, if you are stable and, one of the things that happens in COVID-19 is that many patients just remain at home. They're hiding at home. So I said, keep there. That's fine. You're stable. We can talk all you want, and I can see you, that you're fine. But there are other patients that cannot do that they need help. Yes. So the point is that at the end is that depending on the level of disability, what are your values as patient, then you can make a plan. And that plan may be with yourself, or you can have someone that is your power of attorney, or someone that can help, or family members, and needs to be discussed. And there are other considerations, especially when you are a patient that is quadriplegic and you cannot move any arms or legs, and you cannot talk. These are rare occasions, but we have patients like that here. We manage those patients, and we give them the same attention that any other person that walks in that can talk.
Talking with family or partners and friends about what the future may have in store can often be stressful and a real source of worry. What's a good way to start these conversations?
Yes, this is a very important question. I'm very happy that you bring this up. That conversation starts well when you're diagnosed. Obviously, our attitudes toward MS has changed from diagnose and adios 30 years ago to, well, we can do something. Right now, we are very empowered as a scientists and clinicians to start early, to really go after the disease and make sure that primary and secondary prevention measures are in place. So the discussion about the disease processes start at that moment. So at some point during the visits, perhaps will be important to include a family member that is going to be responsible for that patient. And the discussion will depend, obviously, on the level of disability of the patient, as I said, or the level of, I mean, I see patients with that they have so progressive and very severe disease that they cannot interact with anyone, and so they have power of attorney. So the idea is to start in the beginning or at a level where there is a notion that there is some progression of the disease, if there is progression. Remember, right now with our medications, we think that starting early, being aggressive, having all these discussions and knowing about your disease can change your trajectory.
You know, there are so many things to plan for as someone ages with MS, like home accessibility, finances, home care or long-term care, and even end-of-life directives. How does someone start planning for all this?
Yeah, well, we in general, we had to include our social workers with a lot of experience in the field. And there are now programs. We have here a palliative care nurse practitioner that can help us when that conversation happens. But as you realize that you're getting into the 60s, these are conversations, especially the conversation of how is my health, and then if your health is poor, then you go to the next level. Now, obviously, for someone that is very sick, the realization of this conversation can come organically, naturally. I mean, he can say, it's good, it's just, we need to have a plan, or wife or kids in a very small family visit or family meeting, they can discuss all these issues. I mean, I had the fortunate situations where I need to talk to the family about a patient, especially in the inpatient service. And then we gather together, we explain and we listen to what they have to say, what the values are, so we can make the next step, the next plans. But yeah, that's an important discussion to have as soon as we appreciate that there is a direction that merits that conversation.
Well, you've shared a lot of really important information about a topic that more and more people are starting to think about and talk about. What would you say are the top takeaways that you'd like our audience to remember?
Yeah, so I think that, over the last 15 years, I have dedicated a lot of effort to close gaps in MS. And there is a huge gap in what I call personalized education. In this specific topic, patients, and he's actually here in this slides, you need to be ready for an appointment. You need to actually take the best out of the appointment, get ready, and be ready with questions. So I think that the three main issues I'll take away right now, or four, will be please keep a diary of your symptoms. Think about the symptoms as a burden. I mean, there is an accumulation of symptoms. You need to get a tally. You need to know, what time, what frequency. Be ready to discuss that. You come to my clinic or any MS center because of the symptoms, the majority of the time. The second is, it is important for patients to understand what is going on with your brain. It's like your garden. You want to keep your backyard, beautiful and healthy. Well, you need to know what your spine and your brain looks like. I mean, your lesions, the frequency, where are they, whether they had the so-called T1 black hole, etc. Do you have new lesions? Are they enhancing? This is important because many doctors, not all of you go to an MS center. Many of you go to local neurologists, and many local neurologists will say, well, you have a lesion that is new, but let's wait and see what happened with that. Well, guess what? If you have a new lesion and your doctor doesn't change medications, well, that's not what we want. That's not what the American Academy of Neurology suggested. That's not what the MS Society suggests. We need to actually anticipate more disease. The third point that is important is actually, what are your risk factors for progression? And we have now a lot of information, great deal, about things that may be very relevant for progression: smoking, vitamin D deficiency, diet, a diet that is not going to help you, a diet that will produce you to have hypertension. That's another important thing. So you need to know that. And finally, is this concept of healing or resilience. We need to empower the patients to try to go back to a resemble of a great life. I mean, you're not at fault that you have MS, but we want to make sure that your goals and your aspirations are met. And in order to do that, you need to appreciate and forgive yourself and go forward with something called resilience and healing. Healing is this, reacquiring this sense of wholeness. I know sometimes it's difficult because you say, I cannot see well, but I'm a glass full kind of guy, half full rather than half empty. So I take you as you come. I mean, I always tell patients, listen, this is life and you're about here. My job is to steer you this way. And whatever your goals are, let's work together. Let's find ways to help you. But you need to help yourself. And sometimes it's difficult because patients, they feel shocked. And by the way, one of the most important things is not in the other side, it's when you get diagnosed. I think that patients, when they get diagnosed, they get sick of the diagnosis. There is a powerful statement about having a chronic disease like MS. So we want to take that stigma out. We want to fight, and that's what we do. So these are the four areas that I think that you need to be ready, and you can actually copy that and take it to your next visit and say, my doctor said that, let's see whether you know about this. If you as a patient, you're empowered, we have half of the battle, won here in MS.
Well, I think that is some excellent advice. I think we have time for one more question from our audience today. And actually, it's a family member of someone living with MS. Megan says her dad's been living with MS for 20 years, and she's wondering what is the best way to support her dad as he ages.
Yeah, this is a great question. And again, we're talking from the perspective of a family member. And, we talk always about MS as a one person's disease, but in reality, it's not. I mean, the disease affects everyone, and there is different perspectives. I mean, my mom was sick at a time, even for a doctor, I'm a doctor, and when my mom was sick, I was like, wow, I was shocked to know that this is impactful to me. So I think that it's important to attend to her needs and expectations. And that's what, family member visits or follow-ups are important. And the way that I will say to this person how to help and prepare is actually know in what capacity can you help. Are you living with him? Are you living close to him? Are you, how old is the patient? What are the immediate needs? Safety is a very important thing. Considerations of comorbidities, complications. So there is a laundry list that can be analyzed, and that's why there is a combination, and that's what I support for all patients, is that you get seen by an MS neurologist that is the leader of a team, and you have a great primary care doctor that is interested in taking care of all patients or older patients, and with that you make a team for that particular patient.
Well, I want to thank all of you who submitted your questions, and thank you, Dr. Imitola, for being with us today. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. First, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. And you can reach an MS Navigator by phone, email, or through the Society's website by chat. And please visit the National MS Society's website to learn more about COVID-19 and MS, and you'll find great resources to help you live well with MS as you age. We also know that these are particularly difficult times for so many people, and I want to make sure that you're aware that the National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. You can reach them by calling 1-800-273-8255. Every week on Real Talk MS, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Walk MS 2021 is coming this year, and this is the year where Walk MS will meet you where you are to connect, celebrate, and make a difference like never before. You can learn more and register at nationalmssociety.org/walkms. You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like, subscribe, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS, COVID-19 vaccines, and of course, updates on upcoming programs just like this one. I'd like to thank Dr. Jaime Imitola for joining us today, and I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webinar is going to be available on the Society's website at nationalmssociety.org/MSExpert. It will also be available on Facebook and YouTube. I hope you'll join us for next Friday's edition of Ask an MS Expert, when we'll be talking with Dr. Linda Mona about sex and the different ways that MS can affect sexual feelings and functions. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute and please fill it out. On behalf of Dr. Jaime Imitola and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.